What does a man go through when they're getting on TRT?
I guess I'll do a video on injections. I don't know why people haven't done this before. It's always a matter of raising levels to resolve symptoms. You should be able to make any type of injection work in an individual man done correctly. What you're trying to do is find that dose and that response that gets most men where they need to be as far as symptomatic resolution.
So we're back with Dr. Keith Nichols. Very happy to have him on the channel. And we've been on a different channel together before, and it's really great to talk with you about, in particular, what does a man go through when they're getting on TRT? What are their options to other forms of testosterone treatment? Or maybe it's just slots into for certain men who may not get on with wanting to do injections. So hi, Keith. Good to see you.
See you again, Mike. Man, great to see you. So here in the United States, of course, we have multiple delivery systems. I use primarily two methods of delivery for my patients. It's going to be injections. Yes, there are other methods of delivery. I just don't find them as efficacious. And of course, they're more expensive. And I find that a daily utilization of either one is going to work the best, Mike. So I like either daily injections or daily cream. The injections can be a little tougher long-term for men, and I get that. So if they don't want to do daily, then I would certainly recommend every other day and really no less than 3 days a week. I don't really even prescribe testosterone injections less than 3 days a week, but most of my guys that are on injections do daily or every other day, and there may be a few that do 3 days a week.
Before we go into the creams, a little bit about the daily options and which testosterone that you use. You know, in the UK, fortunately, we've been able to get a hold of different types of testosterone cypionate, but we also have a very special testosterone propionate. And a lot of people traditionally thought testosterone propionate burns and stings. And I've seen this from compounding pharmacies in the US, but in the UK, we have a special formulation, a licensed product that comes out of Spain. And we find that there's no burning and stinging. Now, the caveat is it comes in 25 milligrams per 1 ml. And there's 4 in a box, which is perfect if you're doing less than 25 milligrams, but not perfect if you're going to do a subcutaneous. However, you could possibly do a shallow intramuscular with that. I mean, how would you dose that? Do you even dose testosterone propionate, or do you have a different?
We don't. Luckily, we've got cypionate here, and that's my primary go-to testosterone here in the States. But as I've said before, and I'm glad you brought up this question, the conversation, look, you can make any of them work in the right hands, in your hands or in the right hands, and guys that we associate with, you should be able to make any of them work in an individual. I mean, let's just face it. If you and I were on a deserted island with a group of men and we only had one method of delivery to take, we'd find a way to make it work, and it would work. It's just that there's just so many different methods now. There's a lot of confusion out there and all the misinformation that's on, social media and forums. But I'm able to use cypionate here. That's what I use. I don't have anybody that requires any other ester other than cypionate. They all do well with that. And that's my primary method of delivery.
And how much roughly? It depends on the patient, right? 10, 12, 15?
I'm going to go ahead and, spill the beans here. Look, every clinician has what they find works for their population of patients that they serve. Now, I do a middle-aged and older group of men. So I find that a daily utilization, if we're going to speak injections, then what you're trying to do is find that dose and that response that gets most men where they need to be as far as symptomatic resolution efficiently, all right? And my starting dose for testosterone injection with cypionate, for instance, is 30 milligrams a day. That's what I have found that works the best for my population of men. Of course, we're focusing on symptomatic resolution. And when they do their follow-up, of course, get their labs, do their follow-up symptom questionnaire, and then we make adjustments based on symptoms and levels. And it's always about this, and I'll repeat this every podcast that I'm on, is that it's always a matter of raising levels to resolve symptoms and at the same time avoiding any unwanted side effects. It's just a simple balancing act in each man. But I have found that 30 milligrams a day tends to work the best from a clinical standpoint for the group of men that I treat with injections.
Do you find with the cypionate, it kind of builds on the other because it does last a bit longer? Obviously, you've lowered the initial dose compared to what you see on the packaged leaflet, but because the ester hangs around a bit longer, could a shorter acting ester like testosterone propionate even be good if it were available? I know it's just conjecture because you said you don't use it, but
But I think that some men could potentially get away with that. I just haven't seen the need whenever I have cypionate available. Just haven't seen really that need to go to that short of an acting ester versus what I've got with the cypionate.
it's going to last probably 36 hours anyway on the testosterone propionate. So
And when we get right to it, I prefer, now look, I guess I'll do a video on injections pretty soon. I don't know why people haven't done this before, but let's talk about injections real quick. Once again, you should be able to make any type of injection work in an individual man done correctly. I find that there's no need for deep intramuscular injections anymore. Of course, injecting into the deltoid and gluteal muscles. So I recommend that men either use a shallow intramuscular or a subcutaneous injection. I prefer shallow intramuscular. They work just as good. I mean, guys can argue over one converts to estradiol more than the other side and the other. When you look at that actual study where they compared it, estradiol was higher initially in one, and then and lower in the other, and then higher in the one that was lower to begin with at the end of the 2 weeks that they looked at it. But the point is that just shouldn't matter when it comes to symptomatic resolution. I like a shallow intramuscular injection. They're not as painful. They're so easy to do. When I recommend injections as well, I recommend whenever I was injecting, most are going to do daily. Then there's some that do every other day, and then a few that do 3 days a week. It's up to them. I'll tell them from the beginning. I recommend daily. That's what I see works best from a clinical standpoint, as far as improving all health parameters. I mean, think about it, Mike. The Leydig cells in the testicles, they don't store testosterone. It's a constant release. Yes, there's a diurnal variation, but when you're healthy and producing enough, it's a constant production of enough. So I just find that a daily application works really well. But I'll tell them, and if you're not going to do daily, then just do what you would do daily, double it up and do it every other day. And then, of course, it's easy to divide it into 3 injections they want to do 3 days a week. And when it comes to the injections, once again, the subcutaneous, yes, I've done them all personally. They can be more painful. They can go wrong really quickly. If you don't do it just right, you're going to be left with a red, painful lump. I don't see that happening with the shallow intramuscular injections. And once again, I was an experienced injector. I mean, not just with testosterone, but you got to remember, I literally drove a needle for my medical career in spine and sports medicine. I gave injections all day long, epidural steroid injections, you name it, any type of joint injection, intramuscular injection. But the good thing about a short 27 half-inch gauge needle and shallow IM injections, I loved injecting my thighs. See, all these men think you've got to inject what in the gluteal muscles. Those are for deep intramuscular injections. Those are for the 1.5-inch long needles that we use in medicine to deliver antibiotics or other substances. You do not have to inject those muscle groups when you're using a small 27 gauge half-inch needle. I was a big fan of injecting the thighs. I would alternate every other day. It's just so easy to sit down and relax, sterilely, use alcohol into the, of course, your injection site, and then, of course, inject. And it's just straight in. You could see very clearly to do a very precise injection. You weren't having to hold the needle up in any weird angles. Now, if somebody's just going to pull up into their syringe, what they're going to inject that one day.
So if you're considering testosterone replacement therapy, TRT, why not reach out to one of our doctors at Balance My Hormones, where you can get just a simple advice call for only $59.95. Also, whilst you're watching the channel, don't forget to subscribe, like, and hit the notification bell so you get the latest content from Balance My Hormones. Until next time, this is Mike, and wishing you the best of health.